Dear colleagues and friends, it is a great pleasure to welcome you. My name is Danuta Wasserman, and I am president of the WPA. And in my everyday work, I am at Karolinska Institute in Stockholm, Sweden, and work with suicide prevention and mental health promotion. You probably know Karolinska Institute from awarding the Nobel Prize in Medicine or Physiology every year. My disclosure statement is that we have a company at Karolinska Institute which is working with mental health of young people. Today, I will speak about World Psychiatric Association, about mental health and mental disorders, treatment gap and treatment efficacy, as well as the global mental health plan for years 23-26 at the WPA. The World Psychiatric Association has 145 psychiatric societies from 121 countries, with 70 scientific sections and with more than 250,000 psychiatrists. The mission and activities are very broad. We work with scientific programs, collaborative research, educational programs, with World Congress of Psychiatry, with regional and co-sponsored meetings, with statements and guidelines about mental health disorders, but also about mental health promotion. We have also advisory committee on response to emergencies, with a very important role of preparing well-adjusted to different cultural contexts, different ages and sexes, materials, how to help persons in crisis in a scientific, well-grounded way. What is mental health? There is a very good definition of World Health Organization about that people with good mental health, they connect well, they function well, they cope well, and they thrive in life. It is important to be able to cope with stresses of life, to know how to do it, to realize what abilities each one of us has, to learn well, to work well, and to contribute to the community. Global prevalence of mental disorders for adults is approximately 13% of global population is living with a mental disorder, mainly with depressive disorders or anxiety disorders. 47% of males, 52% of females, among approximately 970 million people in the world having mental disorders. Among children, there are 8% of children and 14% of the adolescents which live with a mental disorder. Global burden of mental disorders is very high also, especially depressive disorders alone are the second leading cause of global years lived with disability. People with severe mental health conditions die 10 to 20 years earlier than the general population, which is not just, and we must work for a better treatment and better health conditions. We know also that there is a very high comorbidity of mental and somatic diseases. Mental illnesses and unhealthy behaviors increase the risk for physical diseases and related deaths, especially in diabetes, cardiovascular diseases, people with metabolic syndrome, but also in persons with cancer, hepatitis B and C, and HIV, and of course, hypertension. Global epidemiology of suicide. The estimated number of yearly deaths due to suicide is, for the moment, 700,000. But they are underreported. Globally, suicide rate for males is more than double that for females. What is important in improvement of mental health? Mental health problems in 50% are established by the age of 14 years, very early. 75% are established by the age of 24 years, which means that we really need to work with risks and unhealthy behaviors encountered during adolescence. We need to start with early prevention and even earlier with health promotion. Globally, 20% of people with mental disorders do not receive treatment. The treatment gap in low and middle income countries can reach up to 90%. What are contributions to this treatment gap? Of course, lack of resources to have good policy and funding, limited availability of mental health services, too high treatment costs, and lack of integration with primary care. But there are also barriers to help seeking, like stigma and discrimination, lack of mental health literacy, lack of awareness about the possibilities for treatment, cultural beliefs, and language barriers. What psychiatric treatment efficacy says? In the paper published in 2022 in the World Psychiatric Journal, which is the main journal of the World Psychiatric Association, shows from 102 meta-analyses from more than 3,700 randomized controlled trials on 615,000 patients that both pharmacotherapies and psychotherapies needs to improve. We need new treatments. But we also know from this paper that they are good evidence-based treatments with quite good efficacy. It could be higher, but still it is good. But they are not sufficiently implemented due to the lack of resources. What we need to do to achieve better mental health? We need, of course, implement those evidence-based therapies. And in my action plan for 23 to 26, we will have a specialist corner which will elucidate main psychiatric diagnosis for your clinicians, but also for other staff, with the angles from prevention, promotion of healthy lifestyles, ethical aspects, use of the digital medicine, how we can implement the therapies which we know work. We need also to work with mental health promotion, self-help, and adoption of healthy lifestyles. So in the WPA Global Mental Health Program, we will take into consideration all those aspects. This program is also built on the United Nations Mental Health Agenda and General Agenda with 17 Sustainable Development Goals, where goal number 3 is about good health and well-being, goal number 4 about good quality of education, goal number 5 about gender equality, goal number 10 about reduced inequalities, and goal number 17, partnership for the goals, which means that we need to collaborate with all sectors in the societies in order to increase awareness of mental health issues. To implement the work on treatment and prevention, of course, need to engage all of us. We need to communicate about what we would like to do. We need to implement good preventive and mental health promoting methods, and we need to evaluate. They are already very good examples of mental health gap action programs produced by World Health Organization on depression, psychosis, epilepsy, child-adolescent mental and behavioral disorders, dementia, self-harm, and suicide. And my center produced those programs and guidelines, especially on self-harm and suicide. I will give you some examples of mental health promoting and preventing programs from schools, workplaces, and not so much online and communities due to the lack of time. What is important in mental health promotion, as I mentioned before, to diminish lack of knowledge. We need to have better mental health literacy. We need to have better awareness and skills training, how to cope and how to improve our mental health. And we need also to work with screenings in different settings, in somatic medicine, in GP's practices, in the working places, but also in the school settings. The program which I ran many years ago in Europe, which was funded by the European Union, and the program was called Saving and Empowering Young Lives in Europe, SAVING, showed very interesting results when we did cluster randomized controlled trial on 11,000 people in 168 schools in Europe, where we compared the gatekeeper training, it means teachers training and other gatekeepers in schools, professional screening, when we use psychiatrists to screen youth for mental health problems and give them treatment, youth aware of mental health, which is called YAM, and which increases awareness among students and gives students tools how to cope and when to seek help, professional help. In comparison with minimal intervention, showed amazing results that incident suicide attempts could be diminished significantly by half, as well incident severe suicidal ideation was diminished by half, and incident cases of depression were diminished by 30%. This effect is higher than those seen in other successful universal public health intervention regarding bullying and bully victimization, and interventions on addressing smoking cessation. You see numbers for smoking cessation was diminishing by 14% and bullying by 17 to 23%. In comparison with depression, 30% in YAM study versus control, and suicide attempts and ideation by more than 50%. What we are doing now in World Psychiatric Association, and I would like to advise you to look at the website, because the entire action plan for 23 to 26 is now on the website, with the description of the specialist corner I mentioned, but also with the description of promotion of healthy lifestyles, especially physical activity and nutrition. In the near future, also description of the research protocol, evaluating those healthy lifestyles influence on mental health of our patients, but also of us, our psychiatric staff, which is recommended to perform exercises with patients, because healthy lifestyles are very important for us as well. Sleep hygiene, physical activity, nutrition, access to green spaces, intellectual stimuli, good working conditions are extremely important to us as psychiatrists as well. And we know that healthy lifestyles improve physical health, mental health, and quality of life. They prevent physical illnesses. Even psychiatric disorders, especially depression and anxiety, have good results, but also rehabilitation measures in schizophrenia prevent cognitive and functional decline. And the target groups are both patients, professionals, but also general population. So we call you all for action to promote healthy lifestyles among your patients. Enhance self-help possibilities and bridge the treatment and knowledge to practice gap to achieve better mental health for all. Thank you very much for giving me the opportunity to join you. This is a picture of Stockholm. So when somebody of you is in Stockholm, please visit our institute and my national center. I would also like to welcome you to the next World Congress of Psychiatry in 2024, between 14th to 17th November in Mexico City. Thank you once.